Swelling and fluid retention in the body during pregnancy is incredibly common, especially in the final months of pregnancy. My name is Kelly. I'm a physical therapist and a certified lymphedema therapist that specializes in swelling and edema. I also happen to currently be about 7 months pregnant at the time of recording this video. So I am putting together a series of videos about swelling management during and after pregnancy that will be in a playlist on my channel. So be sure to subscribe and follow along to see when all of these videos are released this year. But today in this video, I'm going to share about swelling in the body during pregnancy and the best ways to manage and treat it to help decrease that aching and pain. Swelling occurs in pregnancy for various reasons. First, there is an increase in blood volume that occurs for the body to keep up with the demands and support for the baby or babies during pregnancy. The body also tends to have more fluid retention starting in the second trimester and progressing further into the third. There is also the potential for more restriction in blood flow from your legs back to your heart because of the congestion that occurs in the pelvis and the abdomen with that growing baby and the lower amount of space for that fluid to move through. The good news is that mild swelling and edema doesn't harm the baby or you. However, if there is any rapid swelling or severe swelling, especially in the face or the hands, it's incredibly important to contact your doctor for health and safety reasons, as this can be caused by other various medical issues. For mild swelling, we tend to see it worse by the end of the day after someone has been up and active and on their feet, and better in the morning when the legs have been elevated all night. Now, if someone tries to sleep in a recliner, they may also notice that the swelling is still worse in the morning, but that's because gravity does play a role in the swelling too. So how do we manage and treat the swelling? The first thing to do is try wearing compression stockings during the day. Compression stockings come in different styles as well as different compression levels, and this does matter. So generally, most individuals who have just mild swelling in the legs by the end of the day will note that a compression level of 15 to 20 millimeters of mercury of pressure, which is that mmHg, is enough. This number should be on the box or the tag when you are searching for them. This is a really mild level of compression and does work well for someone who has just that little bit of swelling. If someone has more moderate swelling by the end of the day, then they may need to increase to 20 to 30 millimeters of mercury of pressure, which is more of a medical grade level of compression. This level of compression is also helpful for those who have more chronic but stable swelling. Say they had some swelling prior to pregnancy, they may need a little bit more support during pregnancy. So I will link a few of my favorite brands down below that are considered medical grade and some of those little more mild ones of 15 to 20 that someone can check out. For example, I have both 15 to 20 and 20 to 30 just for different reasons. Just lounging day to day, there are thicker ones. These ones are just more cotton, easy to get on and off. These are 15 to 20 by TheraFirm. They are a little bit, like I said, thicker, so I'm in colder months here, and so they're nice and warm, but again, easy to wear, get on and off. If I'm on a plane or I want something a little more profile or more supportive, these are the medical grade 20 to 30, so they are thinner, but they're going to be a little bit stronger in compression. I always look for ones that have silicone band, and I recommend them because if you're getting the thin ones and you don't have a band, they tend to roll at the top, and if they roll down, they will cause a tourniquet right at the top below your knee, and that can make the swelling worse but also be really painful and can break the skin down. So look for ones with silicone band. I will link these down below, but these are the kind that I tend to use day to day during pregnancy, and then also when I'm doing things like traveling. Now, most people swell just in the lower legs, so this may be all they need, but others find themselves swollen all the way to the upper thighs or even higher. So then a thigh-high stockings, which are these, or even leggings, which I have, to show that our full leggings, full pants with that compression in the abdomen area are also something that someone can get and wear during pregnancy. This specific brand is 15 to 20. It's by 𝐏𝐫𝐲𝐝. Again, I'll link it below, but they are pregnancy leggings that have that extra compression for swelling. And then these ones are 𝐏𝐫𝐲 20 to 30, so more medical grade, and they're thigh high, again with the silicone band at the top. So lots of options. Again, I will link a lot of that down below, as well as a discount code that someone can use for 10% off. If someone's looking for a little bit information on how to get compression stockings on and off during pregnancy, there is another video in my swelling and pregnancy playlist that you can go check out, which I'll link up above. Another way to reduce swelling in the feet and legs during pregnancy is with lymphatic drainage. Lymphatic drainage is a massage-like technique to help guide and stimulate the lymphatic fluid through lymphatic vessels and out of the area. It is best to try to use your whole hand with a gentle pressure, just lightly firm in an upward fashion, so foot all the way up towards your abdomen, to try to move that fluid. We want to avoid deep pressure because some doctors discourage deep tissue work during pregnancy if there is a risk of a blood clot. But this is a really general light technique that helps to stimulate the vessels right under the skin to move that fluid. If someone has swelling throughout the whole legs rather than just the feet and the ankles, they want to do a full sequence of lymphatic drainage, which we actually start at the abdomen area, working our way down towards the foot, and then working our way back up. I do go much more in depth with this in the step-by-step instructions with other videos that you can check out on my channel, which I'll link down below. I also have printable handouts and resources on my website that someone can get for step-by-step instructions with diagrams to follow along with, and for how to do that lymphatic drainage in the correct way. And I will link this up above and down below as well. Along with lymphatic drainage, we do deep breathing. You have a lot of lymphatic vessels in your abdomen, and all of the fluid in your lower body needs to move through the abdomen to get back to the heart to be able to be flushed. So doing 4 to 5 deep breaths a few times throughout the day can help stimulate these vessels and support the fluid moving through them. Exercise and movement can also help reduce swelling in the body. The muscles in your body act as a pump to the lymphatic system and into your veins. And so by pumping your muscles, stretching and moving, you can help stimulate the system to get that fluid moving as well. Walking is really simple and easy, but swimming or pool exercises are also really great because the gradient pressure from the water gives pressure, like the same amount as a compression stocking, against your legs to get fluid moving. So you have the pressure of the water with the muscle pump at the same time, and that's going to be a really great way to get a lot of fluid moving and to help decrease swelling. Of course, water exercise is also very gentle on the body during pregnancy, giving some relief of that nagging back pain and the joint pain that we get. Find something that you are cleared by your doctor to do so, but that you really enjoy so that you can stay consistent and get active with it. And then lastly, elevation can help. You won't notice a quick change, and it doesn't allow you to stay active, but at the end of the day and in the evenings, if you're watching TV or reading a book or lounging, then try to get your legs raised, ideally above your heart if you can. This can help assist with a reduction of the swelling and getting the fluid moving. So when someone's laying down at night, that's why it's really great to be in a bed versus something like a recliner. Making sure that we can get our feet up, it can be very helpful for that fluid. So that's what causes swelling during pregnancy, and those are the main ways to help reduce swelling in the body during this time. For more information and content related to swelling and edema management, you can check out the rest of my channel, and you can check out the swelling and pregnancy playlist for more specific content. But I hope you all found this video helpful, and we'll see you all in the next video. Thanks everyone.